To this now, a story that we seldom hear about, health workers going above and beyond their call of duty under difficult circumstances. Now, in Limpopo, the James Furse district hospital, midwives and nurses successfully delivered a set of triplets and another of twins just 4 hours apart. Now, you may say, this is their job. Why must the fish be praised for swimming, as they say in the old days? Well, James Furse is a rural hospital, type that's often stretched with limited resources while serving several villages over vast distances. It is in this same hospital where nurses delivered 9 healthy newborn babies during a storm and without electricity back in 2018. Let's chat to the woman leading the Limpopo Health Department now, MEC Dr. Ramathuba, who joins us virtually from Polokwane. MEC, you are a woman who's made a name for yourself in this position as being on the ground, being hands-on at grassroots level, walking the hallways of the different hospitals and clinics and district hospitals across your province. Give us an idea of what it's like at the Jane Furse District Hospital. Tell us about some of the challenges they face. What is it like there? What is the day in the life of a health worker like it at the Jane Furse District Hospital?
Evening to all your viewers out there, and thank you for giving us this opportunity. Firstly, let me say to all our nurses out there, Happy International Nurses Day.
Indeed.
This is your day, and you need to celebrate it. You need to be proud of your profession, and that's all we can say. And also, from the bottom of my heart and the hearts of many people in this country, I just want to say on behalf of Limpopo, we're saying to all nurses, thank you very much. You have been there for the people of this country during COVID-19. And you continue to be there. The few that makes mistakes, let's not focus and dwell on them. Let us focus on the millions of nurses that are doing a great job on a daily basis. Yes, Jane Furse Hospital, it's a district hospital which is found in Makudutamaga municipality, around the Sekhukhune district municipality. If you'll remember, Sekhukhune District Municipality is one of those municipalities that has been declared by the former president as the extra-nodal, meaning their rurality compared to even other areas of this country is at a worst stage. And it's those districts that we are working very hard as government to try to bring in development. So to attract professionals, firstly, to work in that hospital, it's not easy, it is very difficult. But it's one of the hospitals that when I was appointed MEC, if you go back prior 2017, 2016, back there, they used to call it Rewilefela, meaning you will come back not alive. If families bring you alive in that hospital, the chances are they will be called to come and collect you as a corpse. We worked very hard over the years to turn around that narrative to now become one of those hospitals, especially in maternity, that we continue to pride ourselves. The maternal death in that particular hospital used to be very high compared to other facilities. Some of the issues that we introduced was the change of leadership and management. And the new management continue to inspire confidence amongst the employees. Hence, you continue to hear about these good stories. They are quite a busy district hospital, especially for a level 1, where in their deliveries on average, 500 babies are born in that small hospital. Sure. And including 125 cesarean sections to be done on average on a month, in 1 month. So you can see it is quite busy, considering the type of staff that they have, the infrastructure that they have, and also the level of the hospital that they are. Now, what inspires us about them, it's despite this busyness of this hospital, we continue to hear and read about good stories. And also when you hear the response from the public, the attitude has changed as compared to the previous days.
Tell us about this specific case today. A set of triplets delivered, and then just 4 hours later, twins being delivered, all by natural childbirth. What do you know about what transpired today? How did they go about it? Because that timeline alone is quite impressive, isn't it?
Yes, especially is at night, and you will note that at night we don't operate with the full complement of the staff as compared to during the day. Most of our midwives are there responsible to cover our maternity at night. There will be a doctor on standby that they will call in case there is an emergency which might require cesarean section. So on this particular evening, the first mother, who is a 22-year-old, meaning it was at that time they described as a para one, meaning it's a mother of one, and a gravida two, meaning that was a second pregnancy, only to find that she ended up being a para four. She's now a 22-year-old mother of four. And they progress her like any other pregnant women and who is in labor. And the midwife and the clinical associate helped her, supported her, and she delivered those triplets. As if it was not enough, later on, another 26-year-old also was in labor. They did, the very same team went to assist and delivered. I mean, not to try to, if it's any other area, this would be deliveries which the staff could quickly, when they arrive, say, let's refer to a tertiary hospital because it's a triplet, we don't know what would happen, or let's book for a cesarean section. But because our midwives are confident and they know what to do, they must do the right thing. Sometimes when because most of our women in rural areas, when they arrive in our facilities, they are already at the advanced stage of labor. They don't arrive in their early stage where you can have time to think of referral. So when they arrive, you calculate the time that it will take for you if you were to refer to a tertiary facility. How long will it take to reach Petersburg Hospital or Mankweng? And you realize the best option is to progress this woman and deliver this woman in our level of care. And they've done it, and the 5 babies and their mothers are fine. The 26-year-old who delivered twins has been discharged because the mother and the babies are all fine. The 22-year-old, not that we have anything wrong with the triplets, but if you even look at the age, we are still bringing our social workers here and psychologists to assist because she's also overwhelmed by the triplets, and we are still training her how to feed them. We are still providing her all this social support and make sure that when we discharge her, she and the baby goes to an environment that will be able to be conducive for her to can raise her triplets, because it doesn't assist to provide all the resources and help her to deliver this triplets, these babies, only to find that they are going to go home to succumb to illnesses because
Yes.
the neonates are at vulnerable stage. If we don't provide much needed care, they easily succumb to infectious disease and demise.
Just one final question before I let you go. I was interested that you used the term that your midwives were confident. And when they're confident, you listen and you follow their lead. And you're talking about midwives at a hospital that you said that when you first came across this hospital, there wasn't a lot of faith in that hospital. I'm sure by the leadership of the department as well as the community around it, as you mentioned, because such was the reputation that it had. And the fact now that you speak about, that you use the language of being confident in the midwives, and that you spoke about how there seems to have been this massive turnaround in the faith that the local community now has in that hospital. That in itself is an inspirational story, and one that I'm sure you wish you could repeat at various other problem hospitals that you perhaps are still working on across the province.
Exactly what you are saying. This is the very similar approach that we are at quite a number of hospitals. We can now look back and see some of the hospitals that have improved drastically. And by just turning around or changing the management attitudes, because one of the issues which makes us not to function well as a Department of Health is when you have hospitals management who do not behave like they are management of the hospital. They still want a provincial office to decide on them when to buy a toilet paper, how to procure a toilet paper, and how to budget for it. Now, what we are doing is that we empower our hospital facility managers. We delegate the CFO and the financial delegations from HOD, CFO down to CEOs, so that when things go wrong, we should not always be blamed as the provincial office. There are levels of delegations where you know that in terms of these finances, these delegations goes to the HOD or CFO. But the day-to-day running of the institution, we tend to empower the CEOs and make them to be accountable, to be able to understand that when you are a chief executive officer or a head of institution, you are exactly that everything, the buck stops with you at that hospital, not with the MEC. When things don't go wrong, we will praise you. When things go wrong, we will come very hard on you. And that we have never apologized on. It's something that we'll continue to do. People will not be happy. We are unpopular. You might have noted that quite time and again, there will be also people saying this, but we are doing this because we want things to be done, people to do the right thing so that lives continue to be preserved and lives continue to be saved. So we are really working hard to get all our facilities to be the same as this Jane First. We must indicate the Department of Health is under-resourced, and there will never be a single day when we will wake up and say, yes, we have got enough adequate budgets to do everything. That is why we require men and women who are going to be innovative and appreciate that the material conditions on their ground will never be the same as those institutions in the urban area, those who are coming from rich provinces. We are not majority of our people, to be specific. After COVID-19, we realized that almost 92% of the people of Limpopo do not have medical insurance. They are solely dependent on this public hospital. But I always say to the community around rural areas, including this Makuta Maga municipality, even with the mayor, sometimes I would say to her, you know, if we don't fix this particular hospital, me and you will also one day need the hospital. Should I be involved in an accident around this particular area? This is the only hospital that can help me, even if I've got medical insurance in my pocket, to reach a private facility. It will take hours. And before I reach there, there's a golden hour in health care services. If you get involved in an accident, we don't respond within that particular time, you are going to die. So people must understand that when we fix public hospitals, when we fix rural hospitals, we're not doing it only for the rural community. Even for you who thinks, me and you who thinks we are comfortable, we are protected, we will go to private hospitals. Unfortunately, illness or trauma will not make appointment with you and say, we will only allow you to be involved in an accident way in the metro or in the city. You can be involved in an accident when you are in the village, and that will be the only source of saving your lives. So yes, we work hard. We believe one day we are going to make all these hospitals in the province to be our source of pride.
Okay, Dr. Phophi Ramathuba, thank you so much for that. Limpopo Health MEC joining us virtually there from Polokwane, speaking specifically to us about the Jane First District Hospital and the midwives and nurses there delivering a set of triplets and another set of twins just 4 hours apart. And today, of course, marking International Nurses Day. Look, I was overwhelmed by taking one baby home. All power to those young women taking those 5 babies home. And I was double their age as well. So we wish them and their babies all of the best going forward.